Hello NEET PG aspirants, welcome back. In this video of PYQ series, I will be discussing a very important topic, genital ulcer. I have seen many questions has been asked in various PG examination from this topic, and sometimes it is very confusing to identify the organism on the basis of information given or the disease on the basis of information given. Okay, so don't worry, in this video I will clear all your doubt and will give you a very precise concept so that you will be able to answer any question on genital ulcer. So let's start with the video. So today's topic is sexually transmitted infection, genital ulcer, PYQ number 6. So the MCQ is about a 35-year-old male presented with painful ulcer on glans penis. So which of the following disease may cause the lesion? Lymphogranuloma venereum, syphilis, chancroid, or granuloma inguinal. So to answer this question, you need to know that what are the various causes of, first of all, ulcer on genital. Okay, so the ulcer on the genital, obviously the question is about painful. So for that we need to know that are there any painless cause of genital ulcer? So for that, just see this flowchart. Genital ulcer, yes, it can be painful, it can be painless too. The causes of painful genital ulcer are herpes and chancroid. However, the painless ulcer is seen in syphilis, LGV, and donovenosis. So now you know that painful genital ulcer are seen in herpes and chancroid, and painless genital ulcer is seen in syphilis, LGV, and donovenosis. So as nothing else is mentioned other than the pain in ulcer, so on the basis of this information itself, we will be able to solve the question. So the first option is lymphogranuloma venereum. What we know now that it is painless. Syphilis, the ulcer is again painless. Chancroid, this is painful. And this granuloma inguinal. Yes, granuloma inguinal is another name for donovenosis. So again it is painless. So among the four options, the only painful ulcer causing disease is chancroid. So the correct answer is chancroid. Okay, but obviously in the examination the same question will not come, so they may change the question, and I will also show you some question on this genital ulcer causing diseases. So for that you need to know some further details. So I will not go into too much detail of these diseases. I will just tell you the pinpoint detail which you need to know to solve the question related to genital ulcer. Okay, so first of all we'll see the difference between the two painful genital ulcer, herpes and chancroid. The incubation period, if you'll see, for chancroid it is almost double than that of herpes, that is around 1 to 14 days, it is around 2 to 7 days. The early primary lesion, that the first lesion which will appear in these ulcers or these disease will be vesicle, and in case of chancroid it is pustule. But this pustule, before appearance of pustule, 2 to 3 days before appearance of pustule, what we may see papules. Okay, and the number of lesion in case of herpes, it is usually multiple. Okay, however in case of chancroid it is usually multiple, but it may coalesce to form a single lesion. Okay, and the diameter, it is very small. The herpes is very small, 1 to 2 mm. However this chancroid is variable. Okay, the shape is not very consistent, the size is not very consistent, it is variable. The edges are erythematous in case of herpes, whereas it is undermined or ragged. Okay, remember this, ragged or undermined in case of chancroid. And why it is? Because the lesion in case of chancroid is excavated or punched out lesion. It is excavated or punched out. It will look like that some of the muscle or the tissue from the ulcer base is removed, so it will look like a punched out ulcer. So this is characteristic of chancroid, the punched out ulcer. Okay, and also the edge is irregular, whereas in case of herpes it is erythematous, and also it is superficial ulcer. This is punched out ulcer, this is superficial ulcer. Okay, and the base of the ulcer, if you'll see, It is either serous or erythematous and non-vascular. And just opposite the sanchroid, it will bleed easily and it is purulent. Okay, so this is serous and this is purulent. This is non-vascular, this is very vascular, and it will bleed easily even on touch. Okay, induration, both don't have induration, and the induration in case of sanchroid is called as soft induration, and hence the name of the ulcer or the disease is also known as soft sore, okay, or soft chancre. And as they belong to the same category, that is painful genital ulcer, so it is tender. And the lymphadenopathy is also tender in both the cases. However, in herpes it is often bilateral, and in case of chancroid it is usually unilateral. Okay, and this chancroid, this lymph node may rupture and suppurate and usually loculated. Okay, so these are the differences between herpes and chancroid. Okay, so the key point to remember that chancroid, the lesion is punched out lesion, bleeds easily on touch and under minor ragged edges. The key point for herpes, the lesion is non-vascular, it is superficial, it starts with vesicle, and the edges are erythematous and base is also erythematous. So it is a painful erythematous ulcer. Okay. So now let's see the difference between the painless genital ulcers. So these three are syphilis, lymphogranuloma venereum, and donovenosis. So contrary to the painful genital ulcer, the incubation period is usually longer. Among all these three, if you'll see, the incubation period is very longer compared to that of painful, in which the incubation period is very shorter. In first one, it is 1 week, and second one is 2 weeks. In case of syphilis, it is around 9 to 90 days. In case of LGV, it is around 3 days to 6 weeks. In case of donovenosis or granuloma inguinal, it is around 1 to 4 weeks, but it may extend up to 6 months. And the primary lesion in the previous case, it was vesicle or pustule. Here it is papule in all the three cases. In case of LGV, we may see pustules or vesicles too. Number of lesion is usually 1 in both the syphilis and LGV, and it is variable in case of donovenosis. But in case of LGV, even this lesion, the single lesion, is often not detected or often get unnoticed. Okay, and the diameter, the syphilis lesion is very large, it is around 5 to 15 mm. LGV, it is around 2 to 10 mm, and in case of donovenosis it is variable, there is no fixed size. And the edges, if you'll see, the edges are sharply demarcated, so it is circumscribed lesion. Syphilis is a circumscribed lesion, and it is elevated, round or oval in shape. Similar we can see in case of LGV, it is also elevated, round or oval. In case of donovenosis, it is elevated, but it is not round or oval, it is irregular. Okay, so edge is irregular in case of donovenosis, but not in case of syphilis and LGV. Depth, again, syphilis and LGV, it is superficial or maybe deep ulcer, but in donovenosis it is elevated, so there is no depth, it is elevated ulcer. And we can see superficial or deep ulcer, it is elevated ulcer. Okay, and the base is smooth or non-purulent and relatively non-vascular. In case of syphilis, it is variable, it may be smooth or rough, but it is again non-vascular, similar to syphilis. But and this donovenosis is similar to chancroid, that it will bleed readily on touch and it looks red and velvety. The velvety appearance, you may get a question that a velvety appearance of ulcer is seen in case of donovenosis, which will bleed easily or readily on touch. In duration, the syphilis and donovenosis are mostly firm, but this LGV is occasionally firm. So it may be firm, but it is not very common that you will always get a firm ulcer in case of LGV. Pain is all again uncommon in both syphilis and donovenosis, and it is variable. So sometimes we may see painful ulcer, but commonly we will see painless genital ulcer in case of LGV. Lymphadenopathy, if you will see, in case of syphilis, it is firm, non-tender bilateral lymphadenopathy. In case of LGV, Now this lymphadenopathy is tender, which may rupture and separate, may be loculated and usually unilateral. It is similar to sancroid. If you'll see, tender, may separate, loculated, unilateral, and in LGV also it is tender, may separate, loculated, unilateral. However, in case of donovenosis, lymphadenopathy is absent, and what we can see is pseudobubos. I will describe what is pseudobubo in the later part of the video. Okay. So these are the differences between the various painful and painless genital ulcer. So just some more key point about these genital ulcer. So first, the genital herpes. It is caused by, what is the causative agent of genital herpes? Obviously herpes virus. What is that herpes virus? Herpes simplex virus, and more commonly 2, but can also be caused by herpes simplex virus 1. And characteristic lesion, what we can see here, the lesions are widely spaced and it can seen bilaterally in the genitalia. Okay, so the characteristic lesion is what it is. It is widely spaced bilateral lesion on external genitalia. Okay, and the lesion we may found in genital herpes may be present in varying stages. That means some of them may be in vesicular stage, some of them may be in pustular stage, and some of them may be in painful erythematous ulcer stage. Okay, so we may find ulcer, we may find vesicle, we may find pustule. Cervix and urethra is usually involved in more than 80% women who present with first episode of genital herpes. So it is very commonly involved in case of women, cervix and urethra. And usually the most common manifestation is atypical lesion or clinically trivial lesion compared to the classical vesiculopostular lesion. So this atypical lesion or clinically trivial ulcers are more common manifestations of genital herpes compared to that usual, whatever I told you, this painful erythematous ulcer. Okay, and recurrence, if you see, recurrence is more common with HSV2 compared to HSV1 infection. And the diagnostic, what is the diagnostic of genital herpes? We may do HSV2 antibody, but then again it is not diagnostic because it may be positive even without infection. It may be positive because of previous infection. So the diagnostic, the best one is to do zinc smear. Okay, and zinc smear is done by Giemsa stain. Okay, and what we will see in zinc smear, we will see zinc cells. And what are zinc cells? Zinc cells are multinucleated giant cells with faceted nuclei and homogeneously stained ground glass chromatin. But then the sensitivity is very low, it's around 30%. So what is the most sensitive method for diagnosing genital herpes? It is HSV DNA detection by PCR. Okay, so this is the most sensitive method for detection of genital herpes. This sancroid, it is caused by a Haemophilus species, Haemophilus ducreyi. How to remember this? Haemophilus influenza known to cause meningitis, epiglottitis, and this is the another species of Haemophilus which is causing the disease sancroid. So ducreyi species, ducreyi, and the name this sounds similar, ducreyi. Okay. Okay. And this lesion appears as I told you, is tender, non-indurated, irregular margin, punched out punched out ulcer that bleeds easily on touch. Okay, and the and okay, this bacteria appears in groups, and this group look like school of fish or railroad track appearance. So the appearance of the bacteria as they appear in groups, so this appearance is referred to as school of fish appearance or railroad track appearance. And as it is non-indurated soft, so this ulcer is also known as, or this disease is also known as soft sore or soft chancre. Okay, and the surrounding skin, if you see the surrounding skins, if you see surrounding skin are normal. There is no inflammation, no inflammation of surrounding skin. Okay, the syphilis, it is caused by an spirochete known as Treponema pallidum, and the lesion in this is painless, circumscribed, indurated, avascular or non-vascular, ulcerative lesion. And it is also known as, because of this induration and this lesion is known as chancre, and is formed at the site of entry of the bacteria, and as it is indurated it is known as hard chancre. So hard chancre is syphilis, soft chancre is chancroid. Okay, and this chancre heals spontaneously within 4 to 6 weeks, and as I told you, there is firm non-tender bilateral lymphadenopathy seen in syphilis which will persist for a month. Lymphadenopathy persist for months. Okay, and this LGV, this is caused by which bacteria? It is caused by Chlamydia trachomatis. And which serovar is responsible for this is L1, L2 and L3. Serovar is responsible. And the primary lesion in LGV is basically small, painless, papulovesicular lesion. Okay, and this lesion will heal without scarring. So because of this only it will get unnoticed. Okay, and the secondary lesion is the most common presenting feature. Secondary lesion is most common presenting feature, and when it appears after about 2 to 6 weeks of presumed exposure, because as we don't know when the primary lesion appears, so if secondary lesion appears, so it indicates that the exposure happens maybe 2 to 6 weeks before. Okay, and what is that secondary lesion? Secondary lesion is known as inguinal syndrome. And what is that inguinal syndrome? Inguinal syndrome is nothing, it is painful inguinal lymphadenopathy. Okay, painful inguinal lymphadenopathy, and it is unilateral. Okay, and initially it is discrete The lymph nodes are discrete, but later on they may become matted. Okay, they will become matted and may become fluctuant or suppurative. Okay, and we may find not very specific, but we may find sign of the groove. And what is that? It is basically, if you see here, is the enlargement of the chain of lymph nodes. Enlargement of chain of lymph nodes. This is the inguinal ligament above and below the inguinal ligament, and this inguinal ligament will look like a groove. So this is the sign of the groove, but it is, although it's not very uncommon, but it is documented in minority of cases. Okay, and it is also not specific. It is not specific, and it may be seen in lymphomas. Okay, so it's not very specific to LGV, but yeah, sign of the groove may be seen in LGV. Okay, and this donovenosis, which is also known as granuloma inguinale, and it is caused by Klebsiella granulomatis. Okay, and the lesion, if you see here, is painless indurated ulcer. Okay, lesion is painless indurated ulcer, and the lymph nodes are not involved, or there is no lymphadenopathy. So what is present? I told you in the table that instead of lymphadenopathy, what we can see? We can see pseudo bubo. And what is that pseudo bubo? It is nothing, it is subcutaneous extension of the infection to the inguinal region, and this inguinal region will swell and look like adenitis, but this adenitis is not true adenitis. Okay, this is not true adenitis, so that is why it is known as pseudobubo. So subcutaneous extension or spread of infection to the inguinal region which leads to its swelling of that area, which looks like a true adenitis. So that's why it is called as pseudobubo, but that adenitis is not true. Okay, and we may find 4 type of ulcer in this donovenosis, and the commonest one, or the first one, is ulcerogranulomatous. Second is verrucous. Third is necrotic, and fourth is cicatricial. Okay, and this ulcerogranulomatous is the most commonest. And what we will find in this ulcerogranulomatous? We will find the ulcer will look like beefy red ulcer, and it will bleed readily on touch. So this is the characteristic of ulcerogranulomatous ulcer seen in case of donovenosis or granuloma inguinale. Okay, beefy red ulcer that bleeds easily on touch. Okay, so what we know now, the genital ulcer is painful, painless. Painful is herpes, chancroid, painless syphilis, LGV, and donovenosis. So just see a small comparative difference between these two, which may help you to identify the disease in the question. Okay, so if you see, this bleed easily is characteristic of chancroid and donovenosis. So what is the difference? First, obviously it is painful, this is painless. And second, it is punched out lesion, it is elevated lesion. Okay, the major difference, it is punched out lesion, it is elevated lesion, and there is involvement of lymph node here, there is no involvement of lymph node here. So this is the difference between these two. Okay, which looks similar but differ in certain other manners. Okay, This syphilis and this herpes, again, other than the pain, the difference, if you'll see, both are non-vascular, both have got bilateral lymphadenopathy, both have got superficial or deep ulcer. But again, the ulcer is usually multiple in case of herpes and usually it is single in case of syphilis. So this is the difference between these two apart from the pain. LGV, if you'll see, again it is non-vascular, superficial, deep, single. But how it differ from syphilis? It usually shows unilateral lymphadenopathy. And also now you know that the primary lesion which is mentioned here is usually often get unnoticed in case of LGV. So what we will see inguinal lymphadenopathy, and that inguinal lymphadenopathy is also known as inguinal bubo, and it is more commonly seen in males. Okay, so we will see more question asked on this topic. The first question is, all of the following statement is correct about chancroid except genital ulcer is painful, regional lymph nodes are non-tender, bacteria appears as a school of fish, ulcer bleeds readily on touch. So the first option, if you'll see, the genital ulcer is painful. If you remember chancroid, yes, it is painful. Regional lymph nodes are tender. Okay, tender, may suppurate, loculated, and usually unilateral. So this is incorrect. Okay, so this is incorrect. Bacteria appears as a school of fish or railroad track appearance, and the ulcer bleeds readily on touch, if you remember. So all these three are correct except this. So the answer is, sorry, all these are correct except this. So answer is this. Regional lymph nodes are tender. Okay. Another question, a girl presented with painless beefy red ulcer over the vulva that bleeds easily on touch. What is the most likely disease and causative organism? Okay, so this beefy red ulcer, where I told you this word, this particular word I have used for ulcerogranulomatous type of donovenosis. Beefy red ulcer that bleeds easily on touch, and also one more hint is it is painless. So the first option is out, the third option is out. Now it may be either granuloma inguinal or LGV. If you remember LGV, the ulcer is superficial or deep, it is non-vascular. So the answer to this question is granuloma inguinal, which is caused by granuloma Klebsiella granulomatis, which is a beefy red ulcer over vulva that bleeds easily on touch. So I hope I was able to explain the topic, and this topic and this video will definitely help you to clear all your doubts, and you will be able to answer all the question asked from this particular topic, that is genital ulcer. So all the best for your upcoming PG examination. Take care.